Good morning. I've been joined by Minister Pakula and the Chief Health Officer to provide a number of updates to the Victorian community around the continuing management of the current outbreak. So there were 22 locally acquired cases in this morning's numbers and 1 in hotel quarantine. That makes a total of 107 cases in the 9 days that this outbreak has been underway, which is really just a reminder of how fast this particular variant is moving right across our state. I can advise that 16 of the 22 cases were in quarantine during their entire infectious period. So there is no community exposure sites for some 16 of those 22 cases. And of the remaining 6, their exposure sites are reasonably low due to the current lockdown, and that is also something that should give us all a degree of confidence and hope that this response that we're now into is working. 2 days ago, there were only 6% of our daily cases were fully isolating in quarantine. Today, it is 73% have been fully isolated during their period of infectivity. So what this means is that our contact tracers and our restrictions are working in tandem as part of the public health team's toolkit to beat this virus back and to beat this outbreak back step by step. And that should give us confidence that this is a process that is working, and it is working because millions of Victorians are backing it in and doing the right thing. The Chief Health Officer will speak to the details of these particular cases in more detail in the short period ahead. But what I did want to speak to is to really give a shout out of really big thank you to the many thousands of people who are currently isolating at home. Because of the nature of how this outbreak started, with so many Victorians just going about their normal life at some significant events, what we've seen in the course of how this outbreak has started is a really high number of people getting caught up as either primary or secondary contacts. Currently, we have more than 18,000 primary contacts, primary close contacts, and we have many thousands of households as a result isolating with them or around them. We know that this is both challenging and at times distressing, and it can be an uncomfortable situation for many families who are going through all of this together. But there is no more important task that is underway in the Victorian community and as part of our public health team now than the work those people are doing. And I want to thank them all and give them a huge shout out. You are our line of defence in responding to this current Delta outbreak. Managing that first ring is obviously vital, but so too is the second ring that comes from that of those people's contacts, the secondary contacts. Half of the new cases today were household contacts of primary close contacts. So the important work in isolating both as primary contacts and through that their contacts has been really significant. It was important in 2020. It's even more important in 2021 as a result of the fast-moving nature of the Delta variant of concern, which seems to move quicker, definitely moves quicker, and moves through household contacts at a rate of knots. If Victoria wasn't managing those secondary close contacts as tightly as we are now, the advice that we have is that this virus would have got beyond us already. It has not. Victorians are working so hard to stay up with and get ahead of this virus that we are confident that the work, particularly our primary close contacts and secondary close contacts, are doing on all of our behalf is a critical part of our public health armoury in getting on top of this outbreak. When you combine both the numbers of primary close contacts and secondary close contacts, that adds up to more than 28,000 Victorians right across the state who are out there doing that important work on all of our behalf. This is a big number, and I want to thank all of those Victorians for the huge effort they are putting in keeping us all safe and doing the hard yards for us all to get ahead of this. We could not be more thankful, and we could not be more indebted to you for that effort. And we want to make sure that we can continue to support you and get you through these efforts, particularly as large numbers over the next week will start to come out from that quarantining. So on the home page of the coronavirus.vic.gov.au page, there is now a list of questions as to what you do if you are a primary close contact, and a lot more nuanced arrangements as a result of so many different circumstances coming up over the last week. And there's also advice and information for what you can do if you live with a primary close contact and how the many different circumstances apply there. And can I just again say that the sacrifice, the effort and the commitment that those Victorians are putting on could not be more important than it is. And I'm grateful, all Victorians are grateful, and indeed I think all Australians are grateful for the leadership that you are showing in this important battle. Finally, before I hand over to Minister Pakula, there was a record number of testing results in yesterday. Almost 60,000 people right across the state braved some pretty inclement weather to return the highest single day's worth of tests that we have seen in the 18 months of this global pandemic. And 98.8% of those results are being turned around by the next day. And can I thank our pathology team, our frontline testing teams who have been out there in some pretty grim weather, supporting those some 60,000 people through that effort. It's important because this variant moves faster than any other variant we have seen, and it is now the dominant variant globally. And what we have to do is to use our testing until such time as we get enough vaccinations to get ahead of this as a country. Testing gives our public health team the certainty and the information they need as to how and where this variant is circulating. So can I thank all of those 60,000 people? Can I thank our pathology team, our frontline workers on the testing centres, and everyone involved in that enormous effort. Everyone needs to get tested if they have even the slightest of symptoms. It continues to be the most important thing you can do. And until such time as we have enough vaccines for everyone that wants one and needs one, staying ahead of this is through testing, is through following the rules, is through making sure that we follow all the public health advice. And can I particularly give a shout out to Phillip Island? You'll recall yesterday the COVID commander pointed out that there had been sewage test results locally. That's occurred again overnight. So a particular shout out to the people of Phillip Island is please keep coming forward in the numbers that you have had to get tested. A couple of days in a row of testing when the cases associated with Phillip Island, to the best of our knowledge, have returned to metropolitan Melbourne, makes us concerned that perhaps there is undetected cases in the Phillip Island and San Remo communities. So a special shout out to Phillip Island. You've been doing a fantastic job. A big shout out to Bass Coast Health for the wonderful work they've been doing. But could I also just reiterate, please, if you're on Phillip Island or if you're on the Bass Coast, come forward and get tested. Obviously, if you've got even the slightest of symptoms, but more broadly, given that some people can be asymptomatic in this process, if you haven't been tested yet, please come forward and get tested. We know that testing. If you are out for the 5 reasons that you're allowed, check in, make sure you follow the public health rules. These are the most important things you can do over the next 7 days to help us build the confidence that we're on top of this, which increasingly I'm confident we are. We will get ahead of this through the public health measures, through the support of those 28,000 people, both primary and secondary contacts who are isolating, and the millions of Victorians who are following the rules. We will get on top of this and we will get back to a COVID normal life as soon as we possibly can. I'll ask Minister Pakula to come forward and say a few words about business support, then the Chief Health Officer, and then we'll take questions.